Matthew and I really would like to express our gratitude to all four of our policymakers up here on stage. First, we have Senator Rosenwald. Senator Rosenwald is a Democrat from Nashua and has served in the Senate for several years and serves in an important role in Senate Finance, and you'll be in other committees this year as well.
Yeah, energy.
We have Senator Rochefort, who is a Republican from Littleton. Senator Rochefort served on the Board of Pharmacy, was in the House of Representatives, and now is a senator and will be in HHS chairing and leading that committee, Health and Human Services. Representative Layon lives in Derry, so I'm glad your commute was short. And she has served as the Vice Chair of Health and Human Services, but it's just been announced that she will be the new Vice Chair of Executive Departments and Administration in the House. And in this capacity, she will be working on things like licensure and interaction with the Office of Professional Licensure and Certification. We also have Representative Simpson, who's it's okay. So that's okay. Who is a Democrat from Exeter, and she has just been chosen as the Democratic leader in the House. And I will remind everybody that they are public servants and give so much of their time. So thank you for being here, and thank you for spending your time here.
All right, thank you, Courtney. And I'd just like to echo the appreciation for all of you taking the time to join us today, and all of you for coming. And hearing what folks have to say about the political drivers of health. I know that it's a busy December. You've had a busy stretch. So you had a campaign, you had an election. You're now getting ready for the start of the legislative session in January. So that little bit of downtime at the end of December we're borrowing from. And so I thank you again for allowing us to do that and for joining us. What I'd like to do is, just format-wise, have each of you give a 3-minute introduction about some of the priorities that you have, what you might be expecting in the upcoming session, and then Courtney and I will moderate what I trust will be an insightful conversation. We'll ask questions about the things that you don't share with us and some of the things that you do. But I'm going to start just left to right, I think, from my perspective. Yeah, and this audience's perspective, to start with Senator Rosenwald. And you're mic'd up, so you're good.
Okay, great, thank you. Thanks for having me. So it's a budget year. So we're going to be talking a lot about the next 2 years of state funding, which has impact also on local property taxes. The first thing that I've been thinking about for the last 2 years is the disproportionate share hospital settlement. We had 2 5-year agreements with the hospitals on how to distribute the uncompensated care funds. That expired in June with no new settlement. And so I think there's going to be a lot of work to try and fix that on a fast track, because if we do not fix that on a fast track, it will result in a $35 million cut to hospitals next May. And I think that would be very difficult. I also think we need to continue to build our healthcare workforce, both in the immediate term, but also over the longer term. We're one of the oldest states and the most rapidly aging states. There are a number of things we can do to try and increase the number of healthcare workers at all levels, both now and also as kids are in school. So I'll be working on that. I'll also be working with Senator Gregg, who I see back there, on the budget. And I think it's going to be a hard budget. My first term on finance was in the House in 2011. And I'm thinking there are overtones, because if agencies have been directed to cut their budgets by 4%, and we applied that evenly across programs, that would mean a $100 million cut per year for Medicaid alone. And I think that would be very harmful to not only the people who it serves, but also our healthcare system. We have a small budget surplus from last year. We have a really small surplus for this year with about half the year done, but we've committed ourselves to large expenses to settle the sexual assault cases for the next unknown number of years. I'm concerned about the growing cost of healthcare and the way it's being shifted to the patient. Maybe premiums are stable, but deductibles, coinsurance, the out-of-pocket costs are rising, and we know people are making choices and avoiding health care because they think they can't afford it. And I also, finally, and it's not really a budget thing, but I'm concerned about the legislature setting clinical standards of care. And we've been doing it, threatening doctors. And it's not just about human health care. There was a bill 2 years ago or last year, and it's back this year, to prevent veterinarians from declawing cats. And to me, it's the same thing. We are not experts on cat health care. We don't know anything about cat anatomy or cat recovery or cat pain. And I'm a big believer in having the professions that are licensed govern themselves. So those are the things I'm thinking about.
Thank you, Senator. Senator Rochefort.
Thank you. I thought we were done talking about cats.
We're not.
Thank you. So as Courtney said, I'm from Littleton. Just a show of hands, how many people came down from north of the Notch today? I'm the only one. One, two. We got two. All right, you made the track. The Notch. Well, there you go. So I think that makes the point of what I'm here to talk about today. Is my district covers all of Coos County, the northern half of Grafton County. It's the largest district geographically in the state of New Hampshire. It's 2.5 times the size of Rhode Island. When I ran for office, starting in July, I put 15,000 miles on my truck just to cover my space. So the point being is it's very big, but in addition to being very big, it's the poorest part of the state. So everything that Senator Rosenwald talked about, disproportionate share, quite frankly, that affects my district disproportionately. We have 5 hospitals in my district. I have another hospital in Plymouth that abuts my district. All those hospitals service a lot of Medicaid, and there's a lot of uncovered care up there. And in addition to the priority being a priority of fixing the disproportionate share formula, I echo what Senator Rosenwald said about the budget. It is a budget year. There may be some challenges there. I'm confident that we'll get a budget, and we'll get a budget that works for folks. But at my perspective, it's got to work for my folks. It's got to work for my people up there. And coming from that perspective, I think it will really be helpful, and I think I can add some input on that because in addition to having a high rate of poverty, the highest rate of poverty in the state, we have an access problem to health care in the North Country. And just to put that into realistic terms, the hospital that I was born in no longer delivers babies. I spoke to a Border Patrol agent during the campaign who had his baby on the side of a road in the back of an ambulance because they couldn't get from Columbia to Littleton. So Littleton and Berlin are the only 2 hospitals in my district that deliver babies. Are we going to open the doors of the the labor delivery wards? Probably not, looking at the finances of that. But those places that are still delivering babies, Littleton, Berlin, even Spear Hospital. I mean, Spear is the last stop north of, or south of the Notch until you get to Concord. We have to make sure that we're taking into account the very unique needs that these hospitals have, the access points that they serve, and it's not just access to specialty care, even general practice, primary care. It's a revolving door. A lot of the doctors who have been there a while are full. We're filling it out with temporary physicians, but speaking from my own house, my wife just received notice that she has a new primary care provider because hers left. This is the 4th one in 26 months. So, you talk about establishing care with somebody and establishing, that quality of care. You really need a relationship, and it's hard to get that relationship if we can't. So, like Senator Rosenwald, I'm interested in looking at why we're not. Is it pay? Is it housing? Is it an unfavorable regulatory environment that we have here? As a pharmacist who's been on the Board of Pharmacy for 7 years, I can tell you pharmacy has more rules and laws than medicine and nursing combined. It's out of control in some aspects. So are we over-regulating our professionals to the point that they don't want to do business here? They'd rather go somewhere else. And then the last topic that I'm going to hit on before is, are we utilizing our other care providers to the maximum of their potential? We have a number of schools that are graduating a variety of specialty clinicians. Are there things that they could be doing to take care of patients that they're not, that they're restricted to because of licensing restrictions and regulatory restrictions? I think we're going to look at that very closely, and it really goes back to I didn't do this to I did it because we have real needs up north, and we have a real perspective, and that's what I'm looking at for this this first year anyway.
Terrific, thank you very much. Representative.
Thank you very much. Can you guys hear me, or is this not the right spot? Perfect. I'm Erica Layon. I'm out of Derry, and in high school I actually got to dissect a cadaver thanks to Amgen. We actually spent some time doing that, which led to my love of medicine and health, and led to me spending over a decade on Wall Street helping to bring new innovative medical technologies, mostly implantable, to market with companies for investors finding these ways to save lives. In my time in the legislature, I had the opportunity to be on Health and Human Services, which was a wonderful place to be, wonderful opportunities to help make sure that people are getting the right care at the right place. And now I'm excited to announce I'll be over at ED&A, where I can help work and make sure that people are not getting choked by the regulatory schemes, and just make sure that we're putting patients first and not protecting, that it's always patients that we're looking to protect first within our licensing and with our boards. As far as, I have my notes, since now that I'm not Vice Chair of Health and Human Services, I don't want to tie anybody to anything, or I won't be in the committee. So we have 15 bills that have been filed around licensing and boards. So that's going to be a great opportunity just to really see as we're moving through this whole OPLC revision and make sure that we are moving forward to protect patients. And we also have some priorities to lower the cost of healthcare, improve access to care, and also look and see where we need to have safeguards when medical guidelines have moved past the long-standing standards of evidence and have moved into an area that's not as quite substantiated with proof of benefits and risks. So lowering the cost of healthcare will come from giving people more agency and information when they're figuring out their treatment plan with their doctor. Right now, if you're sitting in your doctor's office and there's a couple different medication routes to go to manage your treatment, you don't know what those different things will cost you when you actually go to fill the prescription at the pharmacy. You may be able to choose Group A, Group B, or Group C that all should have about the same outcome, but it could be hundreds to thousands of dollars different to you, and that may mean you may or may not be able to fill those prescriptions and actually treat your condition. A bill's been filed to make it so that people can have more transparency into what their cost will be in the doctor's office. We'll be working with pharmacists and those that we know to make sure that this is actually doable, but When it comes down to patients and access to care, financial toxicity is one of the big problems. That's when you can't afford the treatment that's been prescribed. As far as that as well, biosimilars are something that's important to me. Those are, you can't call them generics because they grow in cells instead of being made in a lab, but people who have plaque psoriasis, rheumatoid arthritis, and other conditions have had their lives massively improved by the availability of these. Now there's quite a few of the biosimilars, but just because of some definitions, some that's come down from the federal government, and some that we've done in the state, a pharmacist can't say, you know, I know Mrs. Jones, you're struggling to pay for this. We actually have another one that'll cost you $300 less a month. So we could offer you this other biosimilar. We have language in to do that, and we will also be adding language to make it so that the rebates don't come in and just undercut the market and just shift all of the pricing back. Because if we don't say that the pharmacists need to say how much money they're going to get back from the prescription, then all the incentives are going to get out of line again, and it's not going to be patients first. So while it's difficult and complicated, it's an important thing for us to do because, you know, it really, really impacts lives to make sure that they're getting the best medication and that they can afford both that and food on their table. Access to care includes making it easier for patients to be screened for clinical trial participation. We have a good amount for our population size, but given the quality of doctors that we have in the area and the number especially that come across the border from Massachusetts to provide care through all the different collaborations, we really should be able to get more patients tested and screened for clinical trial participation because that might save their life by having that access. And a Right to Try bill has been filed to make it easier to do telehealth screenings so that if you have a particular type of cancer, they may actually be able to enroll you in a clinical trial at a remote site and have your local doctor provide care. That'll require collaboration with the pharmaceutical companies. And I'm actually, it's one of those areas where I'm letting you know about it, but I may not even be able to vote on it because I have some household ties to that general area. But it's really important to make sure that patients have access to every one of these treatments if they're a good candidate. We also want to make sure that our veterans are able to get the telehealth that they need because when you look at the collaborations between the VA hospitals, they may need to see a specialist from another state that's outside of our existing telehealth collaborations. So we have a bill filed to make sure that those who served us are served well by our system. And as was mentioned, hospital consolidation and especially ward closures are a really big problem. We may be able to help fill some of those gaps around some of the licensing and access for doulas because if you're not going to be able to get to a facility, it's much better to have somebody trained that knows when it's time to make a call to get a car or even get a flight. Because if a mom and baby are that critical, maybe we need to be flying them to the right place to save both of those lives. And without trained eyes there with the mom, it's going to be a lot harder to do that. So we'll need to be looking and making sure that doulas, especially home birth doulas, have what's necessary. Sorry. And then the other part too is we need to make sure that the care that's being provided to especially our children are all based on clinical data and evidence. Right now with the Scrimeti Supreme Court case, there's been some pretty troubling information that's come out that the US federal government intervened in the guidelines that came from the World Professional Association for Transgender Health. That combined with the information from the ACLU lawyer and testimony stating that transgender treatment for children does not impact the actual suicide rates of these children is highly troubling. And what we need to do moving forward this year is not yell at each other, not get mad on social media or in the press, but let's sit down and have some actual talks about where the data are, because these are our most vulnerable children. And we should be able to look at the data and understand what risks are there, make sure it's communicated to them and their families, so that this can move forward as a discussion between patients and their doctors and get rid of any need for the government to step in. Because the last thing we ever want to do is have to tell people what is and isn't available. But when medical guidelines have moved beyond clinical evidence, unfortunately, that may be necessary. So I hope any of you that have a problem with that will keep talking and understand what the data are. Because children are the most important thing for all of us. And we need to make sure that they're honored, loved, and respected. And also, we are going to keep an eye on Hampstead Hospital because those are also vulnerable children. That's where we now have for children who are in psychiatric crisis to be treated and cared for. And we just need to make sure that as we move forward in the management, that all of this is done with the right oversight to make sure that our in-crisis children meet their needs. And we need to also minimize the risks of future incidents like we dealt with at other facilities. So with that, the priorities of the House are access to care, lowering the cost of care, and protecting patients.
Thanks, Representative. Representative Simpson?
I think this is on. Yes, great. Hi, everybody. It's good to see you. I'm Alexis Simpson, the House Democratic leader, and I appreciate your patience with my arriving a little bit late. I'm waiting for that downtime that you speak of. We have 177 Democrats that we are currently working to assign to committees, 22 committees. And so we take this work really seriously because, as you know, all the committees in the House affect the social determinants of health, right? It's just as important who's on our Housing Committee as our Education Committee as it is our Health and Human Services Committee. So I know you all are eager to hear who you'll be working with in those particular areas across the State House. So hopefully we'll have that project done soon. I myself, I don't know all of you, I spent many years trying to increase fresh local food access to our public schools and our children. And so that remains a key priority and passion of mine to increase access to local food for all Granite Staters, and I feel that's really an important health issue as well. So you'll occasionally hear me speak more about that. I won't right now because that is not one of the bills that I want to speak to you about, but please keep your ears open for those things as well. Because we do have one related bill in that area. But what I do want to talk about now is a few of the bills that House Democrats are really excited about this year and that we feel make a real difference in the health and well-being of Granite Staters, whether they're children or adults. So overall, we're interested in reducing food insecurity, and so Representative Tulersky has put in a couple of bills that she's hoping to pass that will increase the ability of all students who do qualify for free and reduced lunch do have access to that food during the school day, because we all know that students who are fed have better attention spans and learn more easily throughout the day. So that's one of our focuses. We also trying to reduce the stigma on children who do have free and reduced lunch meals. We also continue to want to keep our community safe, so we've proposed common sense gun safety measures like background checks and waiting periods, hoping to keep our schools, workplaces, and places of worship safer from impulsive acts of gun violence. We continue to focus on threats to our health and well-being around the toxic PFAS issue. So we don't want living near our beautiful lakes and rivers to be a place where people are vulnerable to toxic chemicals. So we'll continue to focus on improving the management of landfills and protecting our water sources from toxic pollution as well. You probably remember this, or I hope you do, from last year. Representative Wallner has been trying to figure out a way that we can allow children who are in the foster care system to keep the money that they receive from Social Security in a safe place so that they have access to it when they age out of foster care or when they leave foster care. It's really important in terms of their future health and life outcomes, in terms of ability to not fall into poverty and homelessness, that they be able to start out their adult lives with enough money to find a place to live and be able to have something to eat. So we'll continue to do that. Representative Wallner has also filed a bill to appropriate $500,000 to the Department of Health and Human Services that would fund and support Waypoint's homeless shelter as well. So these are just a few of the things that I wanted to focus on today because Courtney told me you've already had a whole day of focusing on the social determinants of health, so I'm glad to hear that. But the environmental health of our state is so important to our people, as is the education system and the economic stability, and these are things that we'll try to focus on this year. House Democrats will try to focus on this year regardless of what committee they come to. Thank you.
Great, thank you all very much for that introduction. I forgot to say when I was setting out the ground rules, I guess, is, so Courtney and I have a few questions, but then we also want to open it up to the audience to have an opportunity to have questions. So we're gonna take turns asking you each a question. The expectation is not that everyone answers the same question. If for some reason you feel that you have to weigh in, we want to give you that opportunity to weigh in. Senator Gray, that includes you too, if you feel like, so moved to do so. And so I'm gonna start the questioning. I also wanted to say, this is a citizen legislature, right? There are 400 members of the House of Representatives, 24 members of the Senate. They volunteer their time and talents, and so thank you for doing that and for being here. There are also, I don't know, anywhere between 1,500 and 2,000 bills filed every year, which is an astronomical number of bills to sort through and figure out, prioritize, et cetera. And so again, every bill gets a hearing, and so all the committees that are referenced dig into each of those bills that give an opportunity for the public to come in and talk about those topics. So if you don't get your question asked today, you'll have lots of opportunities to do so going forward, I guess is my point. But also just of appreciation for your service in the legislature. So you've heard a couple times that it's a budget year. New Hampshire does a budget in a 2-year cycle, meaning it's the first year of the biennium. They actually work on the budget and pass the budget. And so I'm going to direct this question to Senator Rosenwald on the Budget and Finance Committee. Budgets, in my opinion, reflect the priorities of a state or of the body setting the budget, passing the budget. And so I'd be really curious, in light of what you said, one is to see clarity, because I thought I heard you said that there was a surplus carryover from last year, whereas what I was under the impression of is that the revenues are not generating what they were targeted for so far. So if you could explain that to us, that would be great. And then
Yes.
The second part of that question, sorry, what are you hopeful for in terms of budget priorities this year, and what are you concerned might not make it in there in light of the fiscal constraints?
So I look at revenues, both general funds and then education trust fund, which has to be supplemented maybe with general funds. Last fiscal year, we had, so the biennium to date so far, we have a $125 million general fund surplus. But the education trust fund is underwater. And that is primarily because business taxes are missing their goal pretty significantly for the 5 months of this fiscal year. And Senator Rochefort, Saratoga weighs me, so you can back me up on this. Business taxes are off 17% versus a pretty conservative plan. And that's our biggest source. Rooms and meals is kind of running even. Tobacco tax is in the toilet, which is good news for health, bad news for budgets. Liquor is missing goal. The interest and dividends tax, which will disappear on December 31st, generated $184 million of general funds last year. And what really has given us any surplus at all is the interest on the state's cash reserves. Because we've got all, $2 billion of federal funds that we're spending slowly, and interest rates have been higher. Those things are going to change. So I'm think when we have employers come in and talk to us, the two things they say their employees need are housing and childcare. And both of those are critical to the healthcare system. Because if nurses or LNAs or doctors or anybody, pharmacists, can't afford to live here, they're not going to come here to work. And if mostly women, and it is mostly women with younger children who are not yet in school, cannot find or afford childcare, they're staying out of the workforce. And in fact, 14,000 women have not gone back to work post-pandemic. That is bad for the employers that are trying to fill jobs. It's bad for those women's financial security, and it's bad for their eventual retirement as well. So that's bad for our healthcare system, which has a lot of women working in it. There is a lot of bipartisan agreement, I think, on housing. And we've done some good work on childcare as well. And I don't know yet what the budget priorities will be in either the House or the Senate. But we've got to get the dish thing done.
Yes. Outside of the budget.
Outside of the budget.
Outside of the budget, but it's money.
Yeah.
I actually had the pleasure or otherwise of serving on the committee of conference that dealt with the dish. And it was very unfortunate. We did end up having a compromise that wasn't agreed upon, but we need to fix this because that is very, very important to make sure that our hospitals are able to continue. So, what's the dish?
Yes, I was just going to say, I'm not sure if everyone knows, and I really don't know how deeply I want to go down this particular road.
I
in light
want
of
to
this.
talk about the dish.
But DISH stands for Disproportionate Share Hospital Payments. It's a source of money that's allocated to providers, hospitals that provide significant amounts of uncompensated care, meaning underinsured people or uninsured people. The Medicaid enhancement tax, the MET part of the MET DISH, is a tax that is assessed on all hospitals in the state of New Hampshire. It generates revenue that the state then flashes to the federal government. Sorry, I don't mean to be coarse about this, but the federal government then sends back dollars to the state. It used to be matching dollar for dollar, is no longer quite that situation. And all of those dollars, portion of them goes to the hospitals for their uncompensated care, and a portion goes to the state's Medicaid program. Significant revenue is generated as a result of the Medicaid enhancement tax, and at the end of last year, as Representative Layon suggested, we were close, but we didn't quite get there. We hope to get there with the incoming governor and legislature sooner rather than later. So the dollars are, I'm looking at Steve on end, 300 million?
219 million.
$320 million are generated as a result of the Medicaid enhancement tax. So it's significant dollars that go towards the state's Medicaid program. Thank you for asking the question, and I hope that didn't take too long. Okay.
It's very complicated hospital financing.
Courtney, you're up,
Yeah.
I think.
Yes.
Oh, did you want to talk about that dish further,
No,
Senator? Sorry.
that's basically what I
Okay.
was
It's a
saying.
top priority is what I heard Senator Rosenwald say.
Yeah, we have to do it, and we have to do it fast.
And you'll be happy to know, Senator Rosenwald, we did talk about childcare and housing today. We spent some time. So I think there may be
Great.
some solutions here in the audience. People might have ideas for you. Senator Rochefort, if I can turn to you. And we did not line this up in this order, but you are next on my list, if that's
All right.
okay. You've had a chance to serve on the Board of Pharmacy and in the House, and thank you very much for raising up the population that you will be representing in Concord. This coming legislative session, you'll continue to hear patients that are clinically ready for discharge, but we are unable to discharge them from post-acute care or hospital-level care for a number of reasons, whether that's lengthy long-term care Medicaid applications or lack of public guardians or lack of in-home supports and services. So there's a number of factors that we're struggling to get patients to the right care at the right time. we will have a handful of bills that will likely go to Health and Human Services that are looking to make targeted, meaningful investments in our long-term care infrastructure. Can you share a little bit about your policy priorities to ensure patients have access to clinically appropriate, timely care when they need it?
Yeah, absolutely. So long-term care actually was one of the first issues that people approached me on when I ran. And we have a number of, being as a House of Representatives member, for those that don't know, one of your other duties, in addition to serving in the House, is you're on the county delegation, and which means you essentially oversee county business, and all of our counties have nursing homes. And all of our nursing homes, whether it be county nursing homes, private nursing homes, we're all suffering from the same issues, and staffing, getting held hostage with staffing, with staffing agencies, for lack of a better word, where that's blowing our budgets out, and getting the right kind of patient mix, where the reality is some pay differently and some better than others, and there's another pro-share aspect, kind of like a Met dish for nursing homes that get involved with that as well. But one thing that became, thank you to Senator Rosenwald, that actually signed off on a bill of hers, I think that will address some of this, is there's currently a moratorium on the number of beds that can be designated for certain types of long-term care, skilled nursing care. And I signed on with Senator Rosenwald to increase that number for a certain type of bed, because we don't want to be housing these people in our hospitals. We don't want to be housing them in a nursing home, or excuse me, in an emergency room, whereas they should be in a care facility that's most appropriate for that. So I'm really looking forward to anything that you have that might address that. I think it's we can't be using our emergency departments as a long-term care facility, even if it's for 48 hours at a time. That's not what the purpose of it, the purpose of that is. So that's definitely something that's been brought to my attention. I've had experience in it, and we'll be looking for ways to actually, whether it's funding, reimbursement, whatever that may be, to properly get these folks in the most appropriate facilities that they need to be in.
Great. Thank you very much.
Representative Layon, we had an interesting conversation this morning about a number of topics, but one of the things that came up was balancing competing interests, and kind of as policymakers, you all are constantly balancing competing interests. You hear from constituents and interested parties, stakeholders, about their perspective on things. Some of them paid, some not. You hear from, you reach compromise, or you don't. And so what I'd be really interested in is hearing, because you listed a number of different items today that were priorities, how you go about your process of balancing competing priorities, and what information you were looking for and is helpful in your determinations. And I suppose everyone might have their own process for this, but I'd be curious to hear your thoughts on that.
Well, thank you for the question. I'm actually an economist by training, and that is exactly what we do, is balancing the competing interests. I'm also a bit of a data person, and especially with my time on Wall Street, when it comes to any particular type of care, I actually go into the source documents and read all the literature that I can. That's where I'm rather unique in the legislature, because not everybody has dug into clinical trials and published peer-reviewed medical journals to the extent that I have. But I do believe that all of our individual strengths need to come together and inform each other so that we can work together in order to best protect the interests of Granite Staters. Now, when you look at the competing interests, that's essentially what all these committee hearings are. Sometimes I see the opposing parties that are coming to a hearing or an administrative rules hearing. And some people get really, really upset about the different sides and how strongly they're advocating for the people that they represent. But that's exactly what a functional representative government looks like. You need to have everybody's voice represented at the table. And when you get to a point where you're silencing some people who are part of the conversation, that's when everything sort of shifts out of alignment. If people are afraid to voice a particular concern, then our policies and our regulations and our guidelines end up sliding out of what actually is sort of that middle consensus view, and it slides somewhere. You know, if you look at it, you look at guys who drive around in tree trucks and some of the things that they need to do around the regulations and some of the commercial codes for driving those vehicles. There's things that they want to bring up to us in the House, but they're afraid that they're actually going to get more inspections from the state. So while that's entirely outside of the hot topics that we were discussing earlier, you always need to make sure that you're hearing those voices. And I have a feeling that you're probably alluding to the transgender care with that question. So I'll hit some of that background straight on. When I was a medical device analyst, I was covering companies when they first had the drug-eluting stents. When those came out, everybody thought that they were going to be the best thing and they were going to benefit everybody. And then some people started dying 6 to 9 months later, and people really didn't know what was going on. It ended up flaking off with the coatings, and it ended up causing strokes and heart attacks. And that wasn't foreseen, and nobody expected it. But until somebody was willing to dig in and actually see what the data saw, it really was an easy change. You actually switched to having aspirin for longer, and by doing that, you weren't dying from a great new medical treatment that was going to help you. I was also there the first time that interventional cardiologists and cardiac surgeons were in a room together for the heart valves that you thread in through a blood vessel. So they can stick them in through your leg and then pop open the balloon, and then suddenly you have a new heart valve. These guys never thought it was going to work. They never thought they were going to be able to work together. And if they had only held to their viewpoints, there'd be thousands of people today that weren't able to live longer with their families and their grandkids, or continue on productive lives for decades because they were too much of a risk. I love medical technology. I love innovations. I want to make sure that people can get everything they can and that they benefit. I also worked with orthopedics. And I know that when you get a knee replacement, you have 2 shots on goal. You get your first, well, there was an innovation that gave you a third if you only replace a little bit of it. But you get your first one, they take out a little bit of that tissue. If that goes wrong, then they take out a little bit more tissue. After that, you don't have any more physiological resiliency. Because you've had aggressive medical intervention, your body is left with fewer and fewer options about what to do for the rest of your life. So if you're 25 and you get your first knee replacement, and then it fails 2 years later at 27 because you continue living an active life, now you're dealing with the fact that you have a piece of metal in your body at your knee that you're hopefully going to live for 50 or 60 years on that, and not end up losing the leg or needing to be bound to a wheelchair. There's always a balance. There's always a benefit. And the biggest problem right now is that people are afraid to talk about the data around care for these children. I'd actually like to set up a discussion in a meeting where we can actually dig into the data with people who understand data and people who want to listen to it. Because this really needs to move beyond the headlines and people screaming at each other. And we need to understand what the data says. Are we helping kids? Or are we reducing their future options in life? And you know, it's up to do. I have to ask you the difficult discussions, and I'm happy to run one of those. I'd actually love it if we can get Dartmouth together, and we can do digging into the details, digging into the data, and actually have a true, respectful conversation and be a leader for the rest of the country on this.
Well, I appreciate you raising that topic. In all fairness, I was going to speak about something much less controversial. I was going to speak about individual liberties and vaccinations. Totally non-controversial, but I appreciate you talking about that one. Courtney, I think your turn.
Representative Simpson, you have been chosen as the Democratic House Leader. This is a new role for you. Thank you so much for your service, and congratulations on the new role. Unlike last year, where the House margins were decided razor thin, decided on attendance, the Democrats are certainly in the minority this year, and there's going to have to be work across the aisle. Can you share a little bit about? We've talked a little bit about your priorities, but can you discuss how you plan to work across the aisle to achieve some of those?
Sure. So I was the deputy Democratic leader last year, so when the House was much closer, but we were still in the minority, and so we were still working across the aisle on all the places where we had success. We were doing so because we worked in a bipartisan fashion with Republicans. So that piece isn't going to change. It's just going to mean that we have to do more of it, more intentionally, and really build relationships and understand where our Republican colleagues are coming from on certain issues so that we can build legislation off of where we have agreement. I mean, I think that's the most basic thing. I think it'd be good for all of you to know that it's probably about 80% of the legislation that we deal with every single year that we do agree on in a bipartisan way. So we actually do a lot of things every year, no matter who's in charge, that affects the lives of Granite Staters, we would say in a more positive way. So that work will absolutely continue, and that work is made better because it brings diverse voices from both sides of the aisle in order to solutions. And like I said, that will continue, but there will also be, realistically, like there will be places where Democrats will want to win and we will not. And so that will be disappointing for us and for the constituencies that we represent across the state. I think it's really important. A couple of things. It's really important for Granite Staters to make their voices known, no matter who represents them. At the end of the day, regardless of what aisle we sit on, side of the aisle we sit on, we all represent the voters, and that's who's going to reelect us, right? And so each and every one of us has a responsibility and a vested interest in listening to whoever shows up at the State House and speaks to us, or whoever calls us at home and shares their particular stories and perspectives with us. And so I would just encourage all of you to continue to make your voices known. I think the challenge is, as you heard in some of the bills that I brought up, there are places where we are representing marginalized groups of folks, right? And so those are sometimes smaller populations, and in terms of like economic stability, like poverty issues, like homelessness. I mean, there are just places where the folks who represent those populations are going to have to be really articulate and vocal and about why the money they need in the budget or the particular piece of legislation they need for foster children or something like that. You're gonna have to be really, really articulate about why you want something, because you can't just sort of rely on, well, that's important to Democrats, so Democrats will make sure it happens. Well, if we're not in the majority, then it needs to be the voters who are doing that hard work.
Yeah, thank you very much. We would love to open it up. I'm sure this is not a shy audience. I'm sure there are questions in the audience. We do have mics that are going to be revolving around if there are questions. If not, Matthew and I have other
We
questions.
have a host of questions,
Yeah.
but I also, there was it was actually something that Representative Simpson just said about articulation of the positions of certain communities, and I'm reminded of this morning's conversation, trying to reflect on this morning's conversation and pulling the threads together, because I think what Philip Alberti would have said is it's about the community coming together and how are all benefiting from the decisions that are made. And so I don't know whether that's what you were alluding to, Representative, or different, but I wanted to pull together the thread for the audience of saying, think about that from this morning and think about what does it mean when there's health equity for everybody in the community, and what might that look like? And so it doesn't mean someone gets less of the pie. It doesn't mean someone gets more of the pie. It means everyone's participating at that table. He would probably correct me on a lot of things I just said, but that's my kind of reiteration of what some of the themes from this morning were. So I'll stop there and see if people have questions.
There's one question over here.
It sounded like, hi, Jessica with New Hampshire Hunger Solutions. It sounded like children's health was important to everybody sitting up on the panel, that they're our most vulnerable population. And a lot of the work that New Hampshire Hunger Solutions does is help to remove the barriers to access for children to access nutritious food at school. There's a bill coming up for Medicaid direct certification. It's been on the docket for 3 years now. And what it does is it automatically enrolls children who are already enrolled in Medicaid for free reduced meals. It would identify about 10,000 more students in New Hampshire, and it would reduce school meal debt. What can we say, like, how would you guys support that, or why wouldn't you support that?
Well, I have supported that. However, it has a big price tag. And we had the money last biennium. This biennium, it's still uncertain. There are ways to make it less expensive, and I think that's what's being contemplated. But what we've heard two things against it. One, the cost. Two, concerns about privacy of the families, which, Frank, I'm a real privacy freak, but I don't really understand that that is an invasion of a family's privacy, because the state already knows that their child is low enough income to qualify for Medicaid. So it's just something I don't particularly understand.
I can actually speak to that as somebody who was a low-income child who mostly benefited from neighbors, but other relationships. It's a lot different to tell one neighbor and have some neighbors come and help you and provide for what's necessary, as opposed to have everybody know what's going on with your personal financial situation. While I recognize that one part of state government may know about that, you become a lot more exposed and feel much more vulnerable when it feels like everybody knows these personal details about your family. It actually was quite uncomfortable, even the times when we had gift baskets of food left on our porch. It ended up being a lot easier when a neighbor would just happen to bring some more food by, because as a child, it was kind of humiliating when people would drive by and see that basket of food on our porch. I mean, my best Christmas was the time when my mom got me a $3 clearance sale backpack at Kmart. You know, it was about pulling together as a family. But the embarrassment of people knowing that we didn't want to share that information with really has impacted me my whole life. And I'm very concerned about protecting that for others too. Because while some people may be comfortable enough to open up about those situations to their community and to those around them and to not mind who knows, you know, honestly, a lot of my mistakes and things I bear openly now today, because we have a lot more in common, especially the stuff we feel ashamed about than we realize. But as a kid, that was devastating to me. And I don't want to put other kids in that situation, even if they're not sure who it is when the stool knows their number. Still, it feels like there's eyeballs on you, and it doesn't feel good.
I just wanted to say I really appreciate you sharing that personal story. And Medicaid direct certification is a way to avoid that, because now families aren't bringing in that piece of paper that could be dropped on the floor on the way to school, and or like having to hand it in to a teacher, and now the teacher knows. And it's now being directly going from one computer to another computer and automatically happening where less people know. So I appreciate you sharing that story, but that is part of this, is to reduce the stigma and help to support the privacy of those families.
Thank you, and I appreciate that those efforts of bringing this together is helpful, but that's also that big brother feeling of being constantly watched and surveilled and having things offered to you that also can be uncomfortable for people. So I think we're all trying to get to the same position of making sure that people in need get what they need, but understanding the concerns of people who view these programs differently than you also helps you to recognize why people would be resistant.
I hate microphones. To go further on what Jessica was just saying, is the schools, at least in our area, whether you're paying for your meal or your parents prepaid through the online portal at the school, or you're getting free lunch, isn't known to anybody. Because all you do is when you go to the register, you give them a 5-digit student ID, or the really little kids, they know them by name, so they just check them off. So there is no embarrassment, because the other kids in your class and stuff don't know whether you're getting free lunch or mom and dad already put the money on your account.
I grew up in the future, otherwise known as California. They're ahead of us on some of these policies. And while ours was also muted, I still felt that stigma, even if it wasn't known to others. But I appreciate all those efforts, because it's much better that you don't have a sticker that says free and reduced. That would be even more stigmatizing to more people.
I think there's another question here, Ann.
Same table.
So really to follow up on that statement, so what can get done so you feel less stigma as a child in these times with technology, like with all these changes from back in the time when you were feeling that way? What would be the solution in your brain, in your eyes, to fix this about not making it so public and keep the privacy and be respectful at the same time, because it's about, in the end, it's about being respectful to everybody?
Well, thank you. I think that's a great question. I think when the family makes that choice that, yes, this is available, yes, I see that 60% of the kids in my school also get free and reduced lunch. We're actually in the majority here. And, you know, maybe we should ask for that help. But there's something different between saying, I would like that help, and the fact that you are voluntarily being a part of that process, instead of it being pushed out that you must need this help because your family is X, Y, or Z. Because that's that agency of saying, yes, I want to be part of that program, please help me. Because even making that step of reaching out a hand, just like somebody going into recovery, yes, join with me, I want this, I want to get better, I want to improve things. And even that is a positive step for agency, and saying that no, it's not a stigma, because it shouldn't be a stigma. So let's talk about these things and say, you know what, if you qualify for it, it's hard for my family to afford $3 a dozen eggs. It's a good thing to be able to benefit for it. So let's all fill in those forms. Let's all do it. There's no stigma. Let's join in. And then it's a positive step forward.
Thank you.
Steve, Anand?
Hey, I'm Steve Anand, the president of the Hospital Association. I'm very pleased to hear that Met Dish is on everybody's agenda. I too believe there's a path forward and look forward to getting to a better place on that. My question really relates to what may be coming to New Hampshire from Washington. You know, given the changes at the federal level, there's lots of talk about you know, changes in the Medicaid program, changes in the ACA, things like, you know, reducing the match on Medicaid expansion from 90% to something lower. New Hampshire's law says if we do that, New Hampshire will end Medicaid expansion. So just curious as to how you all are thinking about managing some of those challenges in the coming budget year as you look to try and balance the budget and make sure that we continue to make the right investments for the health of our patients and communities.
Okay. That's the other thing that's keeping me up at night, is we don't know what changes may be coming to Medicaid and Medicare. So if the federal match on Medicaid expansion goes below 90%, New Hampshire's Medicaid expansion will automatically end. That will toss 50,000 people off of health insurance, and I think in places like Senator Rochefort's district, that'd be very difficult for providers because they'd still be treating patients but not getting paid at all. Mm-hmm. That would be very difficult. But I think because most states now have moved forward with Medicaid expansion, I'm hoping there would be pushback. There would be pushback in Congress against doing that. But the other thing that could come at us would be block grants or caps, per person caps. And I think either of those would be devastating because they would never keep up with the rising costs. So we would be pitting one population against another? Who's needier? Is it children on Medicaid? Is it people in nursing homes? Is it people on the developmental disability waiver? And I think we'd have already marginalized and at-risk groups fighting over diminishing resources.
Just to add to that, I am a, Senator Rosenwald is absolutely correct about my district. I mean, it's a vital component of our healthcare system in the northern parts of the state. I'm a big supporter of expanded Medicaid. I'm hoping we're premature in our worry. I've been watching this myself, and I keep trying to tell myself, you know, this is premature. But I think that there have been so many success stories with expanded Medicaid, and we can show the data that it does work, it does keep populations healthier, it keeps costs down. I think that, you know, if there are real debates about that out of Washington, I'm hopeful that we can counteract that with real data that shows you know, these populations.
Can I just say one other thing about this? Medicaid expansion is the single best source of payment for substance use disorder treatment, which we all know is a huge problem in the state. It's sustainable. The Affordable Care Act required that all states provide coverage for substance use disorder treatment. New Hampshire didn't prior to that. That was the single new insurance mandate that affected us. But I think we go backsliding quickly on substance use issues.
Representative Simpson and then Representative Layon.
Real quickly, I want to add to that we have so far made bipartisan decisions to keep Medicaid expansion when we've had the opportunity. So I would hope that we would be able to work something out again if something changed in Washington, where we'd be able to continue that commitment, because it affects so many different aspects of our communities. Families, children, like the ability of parents to be the best parents that they can be, to be able to be present and well cared for is really key. And then again, for a strong and supported workforce, it has been really crucial. And it's also shown that people tend to be able to move through Medicaid expansion and have a different kind of health insurance and healthcare later, and so new people are always having the opportunity to find a higher degree of health than they had in the past as the program continues to go. So.
And I think that my colleagues have brought up a lot of the risks should something like that happen. Quite frankly, looking at the follow-through rate on the first Trump administration, I'm not particularly concerned about that happening this time. But what I do see is one of the most frustrating things on being the Health and Human Services Committee was so much of what we do was actually dictated by some of the rules and regulations at the federal level. And getting rid of some of those that don't actually benefit care in New Hampshire and actually do make it so that pediatricians can't continue to provide care to particular children because they would miss their metrics on the percentage of children that are vaccinated, and therefore they would not be included in the insurance calculations, and therefore the employers wouldn't want to work with the insurers. There's so much of that red tape that comes out of Washington that I'm actually really hopeful that we can do that, because by removing some of that unnecessary red tape, we can improve the access to care and lower the cost. And if they cut anything that's important, you know what? You got 4 state legislators up here. We can always make it work here in New Hampshire if they get rid of a protection that actually does protect our health.
Thank you very much. Any other questions from the audience? Well, you all think we have a couple. We've all heard the amazing statistic that families with young children are spending more on childcare than housing today. And I am one of them up on the stage, but worth every penny, trust me. At the same time, we know that early childcare providers are not making competitive wages. It's always amazing to me that an infant or preschool teacher is making less than a kindergarten or a first grade teacher. The age difference isn't that drastic, but the wage certainly is. What investments can this legislature make into our childcare workforce to move the needle for young families in New Hampshire?
Yeah, one of the pieces of legislation that I supported last year and did some work on, and knowing that this is a budget year, I held it off this year, is really, I think that, and you're absolutely right, and a lot of the statistics that have been said, Senator Rosenwald mentioned, some other people said it, I mean, our child care providers and our ability for our young families to provide child care is, you know, I don't think this is overstating it, but it's a linchpin of our economy. I mean, it really, especially our healthcare economy. I mean, everything that we've heard, you know, since the pandemic has happened, these people who are not entering the workforce, largely from our environment, because they can't find childcare. I mean, I know, I personally, I can tell you all kinds of stories. But one of the things that I really think is valuable, in going back to what you're saying, the benefit that the kindergarten, the high school, the schools have is a larger pool to draw on for salaries. You know, as you know, as a child care provider, it's directly related to the person providing, you know, getting the services. So, you know, the salaries are commensurate with that. I think it's vital, and I think it's important, and I think that I think there's an opportunity right now to incentivize employers to provide, because it has such an economic link, to incentivize employers to provide health care or child care for their staff. I did a research study about a year ago, and there's like 19 states that have some type of tax credit or tax benefit for employers that are participating in their employees' child care funding. You know, everywhere from building child care centers, you know, which up where I am, you wouldn't really see that because we don't have employers that big, right. But also maybe subsidizing their employees' paychecks with for funds that would go towards child care. In my mind, that benefits both the employee and the employer, and I think there's opportunities for the state to get involved and incentivize those types of programs.
Thank you, Senator. I know one of the pieces we've been exploring at Dartmouth Health is the question around when you have a workforce that doesn't have children in early child care, and how do you balance the interests of the families that do when you offer those benefits to some and not to others? It gets tricky.
And I think one part of early childhood care that we need to make sure we don't miss is those parents who are choosing to stay home during those years, who would happily help with the neighbors and friends' children that are in the area. That's something that in my neighborhood I benefited from, and I benefited other families by doing the same. And by being able to do that, they cooked meals for us as part of the compensation, because she was a much better meal planner than me, and I was home while she was at work. So I was able to pick up her children from school and watch them, and then watch the younger one when he was little itty bitty. Making sure that we are supporting voluntary arrangements between people who already know each other, and maybe loosening up some of that regulation. If I'm going to come knock on your door and ask you to watch my kids, I'm going to want a lot tighter numbers on how many children you're able to have in your house if you're going to have my kids too. But if you know the other parent, if you have a relationship, you see how they handle their kids. There are some people who are just amazing watching a whole pack of kids, and it actually runs better than when there's just a couple. And there's others that you wouldn't trust a house plan with them either. So when it comes down to these voluntary ones, we need to have a little bit more flexibility, because that also can provide some more money for those moms who are staying home and support their household, because perhaps they have a child who has higher needs that wouldn't work as well in a child care center. So while we look to all of these more state-supported ones, we always need to look at our neighbors and each other supporting each other, and make sure that we're not undercutting that, so we can make sure that people have that participation.
Thank you.
Thank you for adding that too. It reminds me that childcare is kind of like housing, in that we're not going to have one bill that solves this problem, obviously, or I think we would have all been able to figure that out by now. But there are some really solid solutions out there. But what I want to lift up now is, like, from the 30,000-foot view, is that there are a lot of the workforce, some of whom are childcare workers, right? But there's a lot of the workforce who just will never make enough money to cover the costs of childcare. And so there is money available for a small number of the population to have help with the cost of childcare. And we are not making the connection, like institutionally, with those folks, so only a very small percentage of the people who qualify for assistance actually know that they can have that assistance or get it. And then when they do, not every child care center will accept that assistance. Only I think it's a third, I don't know the exact numbers, but it's a small number of centers that actually will accept those folks. And so there are some institutional things that we're starting to get right, but we just haven't figured out how to make it work. And that would help with the population who will never have the wages that would be able to allow them to be in the child care market right now, formally.
Yeah, thank you.
I would just add that I think we have two problems with childcare. One is affordability, and the other is capacity. We have not regained the capacity in licensed childcare that we had prior to the pandemic. One teacher means 8 kids get childcare, center-based childcare. So adding even one teacher makes a big difference in a community. So we have to work on both of those problems.
All right, we're right this close between lunch and saying goodbye to each other, so I want to make sure that we make sure that everyone in the audience who wants to ask a question has the opportunity to ask a question. Perfect, because then I have one at the end. Yep.
Yes.
Here, I can take that.
Yeah.
Oh, Anne's coming, Matthew.
I needed to move.
Thank you. So, as I'm sure you are aware, the interest and dividends tax is cut off from the budget, which removes a lot of funding to the state. I'm wondering, what ideas do you have for financial policy in order to make up that money that is now lost because that tax is no longer active?
Thank you for the question.
I'll take that. Well, I think it's the basic, fundamental to understand, taxes are a result of spending. And I think, we're in a budget year right now, and we're going to be going through the budget to examine our spending. And I think that we're going to be finding opportunities where, money will have been unspent, whether it's been positions that have been unfilled that we're managing without. I think there's been a lot of fear and worry about the interest and dividends tax cut, but that was voted on in the last budget, and we agreed upon it, and we're going to go forward in this budget, and we're going to watch. I have every reason to believe we're going to put a solid budget together, a good budget, a budget that works for New Hampshire, and we'll do it responsibly, and we'll find that money.
If I could comment, people don't understand the interest and dividends tax and how over the years it has changed and who it affects. Right now, most of you people have 401s or 350, whatever. With me, with a thrift savings plan. And so those funds are not subject to the interest and dividends tax, as when the interest and dividends tax was created, that if you were saving for your retirement, it would go into this account and you would be taxed on that account. So right now, I'm probably close to being having to pay interest and dividends. Why? Because I've reached 75 and I'm getting my required minimum distributions, and I'm putting that in the bank. So now I would be in this coming year, probably subject to that. So what's happening is you're not only hitting these people who are super rich, you are hitting more and more people who are in my situation and are just trying to get by. So it's the elderly people, the people on fixed incomes that have gotten these savings accounts now and are putting that money away. It doesn't affect that person who's got $5 million who's, you know, put it away in a thrift savings plan and stuff. So the character of the tax has changed, and that's one of the reasons why there was a push to get rid of it, is because of who it is affecting now. So, if you want more questions?
The question was, what's the plan to replace the revenue? I think was your question. I don't think I've not heard of a plan. However, there are some bills filed to expand, make changes to different kinds of gambling that might bring some more money into the state.
I think this, as challenging as it is, it gives us an opportunity where we are going to have to figure out the efficacy of all the different government programs that are in the budget. We've benefited from good financial times and a good tailwind. So we've been able to do that. Back in 11, they just sort of did those across the top cuts. We know that that's not going to be, that's really not the ideal approach. So looking and seeing, just in a business, you would see what has a good return on investment and what doesn't. When you look through, there's so many different programs. We need to make sure that those that are not benefiting the people of New Hampshire as much as some of these other programs that would be underfunded through a top line even cut, that we can prioritize the needs and make sure that, you know, we're not the NIH studying the use of cocaine in dolphins and their activity. So we don't have that kind of waste. We have things that aren't benefiting the people of the state of New Hampshire enough, so we'll be making those hard choices and pouring through it line by line. I'm kind of lucky that I ended up where I was, otherwise I would have been on House Finance and having to do that work. But you know, it's one of those challenges. And two, I also want to talk to Senator Gray's point on this. If you do the math, if you're a really good saver who puts away their 20% in their 401k, and then you hit the required minimum distributions, you're going to have to reinvest all of that they make you push out of that right around 70 years old if you expect to live a normal lifespan. Because you're left with so little in that 401k at the tail end that you will be only on your remaining Social Security. They're not the pensions of old. They're not that process. And we're just now coming into people realizing that you need to reinvest that 401k money. Otherwise, you're going to be relying on your kids or your neighbors or the state in the future. So it is critical. It's an important move that was made last budget. And it's our opportunity to make sure that we're putting all of these dollars to the best possible use.
Thank you very much. I think, Matthew, you said you had one final question.
Well, I was going to pivot to, we have 8 minutes left. We have 4 legislators. I was going to do a 2-minute each or less lightning round to close. Yeah. But I'm not going to give the question. I was going to give a question, but okay. I'm not. I'm just going to say, when you're thinking about what comes to your mind or what do you hope to accomplish in the next session when it comes to health care? I won't even go to health equity per se. I'll just talk about health care. Like, what's top of mind for you in 2 minutes or less, and then we'll give our appreciation and we'll close. How's that sound?
I don't want to go first.
You don't want to go first? We can keep going from left to right. Senator Rosenwald?
Well, if Catholic Medical Center is bought by HCA, 20% of our hospitals will be owned by private equity. And the motive is for profit. I think we should be thinking about what that means for healthcare in New Hampshire. I'm thinking a lot about our Medicaid program. I'm thinking about low-income seniors who become eligible for Medicare but are so low income that they can't afford their Part B and Part D premiums. So I've got a bill for that. I might send it to you.
All right.
I'm thinking about what might happen on the federal level. And I'm thinking about how to build our workforce and make sure that we can attract doctors to the state, that when we educate and graduate nurses, they don't immediately go work in Massachusetts, which 40% of them do, but that they stay here, because I don't want to keep subsidizing Massachusetts as nurses.
Thank you, Senator.
Thank you.
Thank you. My daughter's a Massachusetts nurse.
Okay,
so-
go on. But we subsidize that.
I only have 2 minutes, so here we go. I think my focus is really North Country because we're underserved and underrepresented. Like I said, we have 5 rural hospitals up there that are hanging on by their fingernails, and I think it's vitally important that anything that we do for healthcare in hospitals, we have to account for the fact that these rural hospitals are the only source of healthcare in these small communities. We talk about CMC, and God forbid anything would happen there, but you got a stellar hospital across town. I mean, you get a hospital in Colebrook or Berlin or Littleton that struggles. I mean, it's you're creating a desert, potentially. So really, boosting, supporting rural hospitwe and then access to providers. And again, I talked about that when I first opened up. Is we have a revolving door of providers, not to their fault, but we have to look into reasons why they're not staying. Is it housing? Is it childcare? If it is, we've got to get all hands on deck and do that, because we have one person other than myself that came down from the North Country, but there still is a community up there, and these issues that may not seem big to larger populations are monumental to small communities. So hopefully I filled my 2 minutes.
Thank you.
Thank you, Senator.
Thank you. I think a lot of what my focus this coming year will be is that blocking and tackling. When the government's in the way and is tripping up care providers and access and affordability of care, we'll try and pull that out. If there's a place where the government is needed, then that's where we make sure that the government is there. It's going to be just blocking and tackling to make sure that we're expanding access to care and lowering the cost. I don't know how many of them are going to get any big headlines, but that's how we make things better. Get rid of one extra form, an extra hour of time to get that bill in, and see what we can do in order to make things more streamlined and keep it safe for patients.
Thank you, Representative.
I think I have 2 things. For me, it's really crucial that we do everything we can to pass the Medicaid direct certification for school meals. Those are children who qualify for free and reduced school meals, and they're just not getting them right now. And that means they're not getting the nutrition that they need to grow up healthy, and they're not getting it every single day. And so I think it's really, in terms of an investment of our future, both not just our workforce, because I don't think we should love our kids just because they're our future workforce, but just in terms of their health and well-being at 3rd grade, and again when they graduate, and again when they're 30, their ability to be really strong, effective contributors to our society starts when they're in school, and it really depends on them being able to eat so that they can learn. So that's really important to me. But the thing that is keeping me up at night is that I'm afraid that Representative Layon and I might disagree on what the priorities are that need to be in the budget. So I think there will be some hard conversations between the Republicans and the Democrats when we come to the budget about what feels like it's absolutely crucial for our Department of Health and Human Services to provide, and what we need to let go. I think that's going to be the biggest challenge. So if we can make sure we are taking care of Granite Staters through that, I will feel really good.
Thank you.
I want to thank you all for being here, not only today, but then with us all in January, February, March, April, May, and I know we'll be going into June a little bit. Thank you all for your service and for your time and your willingness to share your time with all of us. Thank you.
Thank you.